All right, welcome everybody. It's really good to see this turnout today. We are happy that you're here as we share the results of a collaborative effort to address street homelessness. We're facing a crisis, certainly for the people who are unsheltered, but also for the broader community. We believe that we can unite our resources and energy to tackle this challenge, and if we do that, we can build a better quality of life for all. I'd like to start by introducing the partners who've spent the past few months working on this plan, and I'm going to ask them to introduce themselves. Let's start at the very end here.
Hello, good morning. I'm Anna Wheeler with Heading Home.
I'm Carrie Stillians with Middle Way House.
I'm Emily Pike with New Hope for Families.
I'm Dana Jones with Wheeler Mission Ministries.
I'm Melissa Burgess with HealthNet Homeless Initiative Program Street Medicine Team.
I'm Carrie Thomson. I actually received the plan but didn't actually work on it, so I will pass it to Forrest, who's on Zoom.
Hi everyone, I'm Forrest Gilmore, the Executive Director of Beacon.
And I am Mary Morgan. I'm Director of Heading Home of South Central Indiana. Heading Home was started almost 3 years ago to work on long-term system changes in our region with the goal of reducing homelessness, of moving people quickly into housing, and making sure people at risk of homelessness didn't lose their homes. Our work is shaped by the Heading Home Plan, which is a broad community-created guide that tackles regional housing insecurity. We work very closely with our community partners, many of whom you see here. They are increasingly concerned about the number of people who are unsheltered in our community, even though there are available beds in shelters to use. Living rough impacts health, and we are facing a public health crisis. That survey revealed that in May, the South Central Housing Network conducted a survey in our region in Bloomington and Monroe County. That survey revealed that 117 people in Bloomington and Monroe County were unsheltered, living in a car, an encampment on the streets, or in a place not fit for human habitation. This is likely an undercount, and by comparison, the 2029 point-in-time count, there were only 29 people who were unsheltered. So you can see that's a dramatic increase, and we're really concerned about the individuals and the community impact. So we mobilized. It's actually Melissa Burgess here who was a catalyst for that work. We're grateful to her. Heading Home convened this core group of shelter leaders to come up with an actionable plan, which is the plan that we're introducing today. We identified 8 immediate priority needs and made the recommendations with the goal of dramatically reducing street homelessness. Those recommendations are: support robust, coordinated street outreach and linkage to services, including emergency shelter and housing, strengthen case management support, strengthen diversion efforts to prevent homelessness, pilot approaches to tackle the flow of people coming here from outside our region, increase the number of housing units with rent or mortgages under $500 a month, bolster security and services for permanent supportive housing, increase the number of beds for medical respite, and determine if there are a need for additional shelter beds, and if so, what kind. And we also have a couple of longer-term priority needs that we identified in this plan that relate to reforming the criminal justice system, to emphasizing inpatient recovery and mental health care for people who are experiencing homelessness that repeatedly commit crimes in the community. And then our second long-term priority need is to continue to invest and advocate for additional housing units that are in that under $500 a month rent or mortgage. So that's the highlights of the plan. We're looking forward to addressing your questions today, but first I'd like to ask Mayor Thomson to come up and make some remarks about the city's role in this effort.
Hi, everyone, and thanks for being with us today. It is with very deep gratitude that I thank these partners who have been working tirelessly to serve our unhoused. In May, with the impending closure of another camp, I asked for recommendations on what we could do as a community to address the growing number of people who are sleeping on our streets. This is the plan that this team, gathered by Heading Home, came up with. They've made some hard choices. They've made careful recommendations. And our community owes them a debt of gratitude. We are not alone in seeing a rise in street homelessness. Bloomington joins the rest of the nation in this crisis. It's a crisis that is complicated by the many facets and faces of homelessness. Each person sleeping on the streets last night has a story and a path that, should we listen to it, would probably explain a lot about why they're in crisis. I've listened to some of those stories, not nearly the number that our partners sitting at the dais this morning have listened to. But I want to assure you that the trauma and survival that each of the people I have talked to has endured is really heroic. I've also talked to many housed neighbors about their concerns for safety, public health, the vibrancy of our downtown, and always, the first thing they express is their concern for people who are living in crisis. Your stories and your belonging here matter to me as well. When I committed to be your mayor, I committed to finding a path towards a solution that provides respect and dignity for all living in our community. There is really little dignity when we have to sleep outside. And there's no pride in a community that thinks it can do no better. We can do better, and we will. Today, we will be talking about the housing part of this picture. That is only one facet. In order to solve complex challenges, our solutions must complement one another, and we must have everyone rowing in the same direction. Our plan must not only be collaborative, but iterative. We will implement the plan outlined for you today, and as we learn more and watch the outcomes, we will continue to improve it. I am fully supportive of this plan, and I will be directing my administration's funding accordingly. I will not be funding organizations operating outside of compliance with this plan. I am committed to working on solutions that provide dignity and progress for all. This plan and the overarching Heading Home plan, which addresses housing security and long-term housing, are focused on housing first principles. Housing is healthcare. Without it, a person will spend their energy trying to survive and never have the resources to truly thrive. This is far more complex than putting some mats on a basement floor for people to sleep or establishing a condoned camping area. We have looked at those models, and they do not provide the improvements to what we have right now. We are a community where on any given night, we have 80 empty shelter beds. We need case management, strategic outreach and support, and a system that is responsive and supports those in crisis in partnership. We have a vision of the highest stability and healing for each person. The plan you see here is a housing plan. As your mayor, it is my job to ensure the safety, well-being, and trajectory of the city as a whole. Now that we have this plan in hand, our city team is working against the budget clock to implement funding targeted to meet these needs in this plan. The city will not be able to meet these needs alone. This will take the county, the state, and federal dollars, and yes, it will take private investment. While we work on this housing piece, we must simultaneously work to ensure the community is safe and welcoming. We set today's press event to talk about this plan. My administration will be budgeting for and announcing plans to address crime, safety, business support, public health, and quality of place in the coming weeks. We've been and continue to be engaged with the community as we seek to meet this crisis boldly, with compassion and expectations for all to treat our community and one another with respect. Next week, we will hold a community workshop to help advise us in the implementation of this plan we're discussing today. Our council also next week will focus their consensus building activity on legislation related to homelessness. And in the coming weeks, I'll hold an event similar to this one to announce our plan for addressing the issues not directly tied to housing. I welcome you at all of these and encourage your solution-focused input by phone and email as well if you're unable to attend events. Thank you for being with us. We are looking forward to welcoming questions from the press, and I'll ask all press with questions to come to the podium so that the rest of the media outlets can hear you. Can I simply turn it? You can do it?
Thank you, Mayor Thompson. All right. As media come to the podium to ask questions, please state your name and the organization you're with. And if there is someone specifically on the panel that you'd like to direct the question to, let us know. Who would like to go first? Step right up.
Good morning, Dave Askins with the B Square Bulletin. Full disclosure, Mary Morgan is my spouse. I submitted these questions in advance, so I'm just going to read them. Well, I'm not going to read them one after another. I'm going to read one and give people a chance to answer. First question, the City Council has at least one potential role to play in helping to advance or in helping to address the problem of homelessness, namely approving appropriations requested by the administration. Question, what, if any, other legislative action does the administration need from the City Council to help with this problem?
That's directed at the administration, so Mayor Thompson.
So we are in preparation for next week's consensus building activity, and that is on Wednesday. The council is holding a consensus building activity, and they are solely focused on getting input about the legislation that is that would assist us in helping solve this problem. We'll probably be looking at regulations about how we are keeping people safe and when we do enforcement, both on camps and on other places where people are sleeping. How do we support them, and which may be a non-legislative issue. All of these things, though, have to come hand in hand with services. And so that is why I really wanted a plan before we address the legislation and enforcement. Of course, we'll also be asking for budget allocations at the end of August.
I would just add that although our plan didn't specifically address legislative issues, we do hope and anticipate that the City Council will fund some of these priorities, as Mayor Thompson suggested. And I'd like to ask, are there any other panelists who have comment on that question? No? All right, thanks.
So just as a follow-up, Mayor Thompson, is it fair to say that it's possible that you might ask the City Council to enact city code or changes to city code that would regulate how encampments get closed? Because right now there's a general police order that that is in effect. There's also there's another sort of general accepted best practice in our region that guides that activity, but it sounds like you're open to the possibility that that could be actually written into city code.
I'm certainly open to the possibility. I will say that it has given us some flexibility to not have it as code. When we are working with people who are in crisis, dealing with a extraordinarily tight timeline or other sort of compliance issues where we must do something by a certain time can really interfere with our ability to meet people's needs. Currently, the city, at the beginning of my administration, met with the Housing Network members, asked for a plan that they had submitted in the last administration for procedures when closing an encampment. We worked with that, and my administration is fully in compliance with those. We've extended the camp closure to 30 days unless there is an extreme emergency that is safety oriented. So this gives us the flexibility to really meet what our community is facing in the moment.
Okay. So moving along to one of the other questions I submitted in advance, and sticking with the City Council. In the City Council's 2025 budget priorities, as conveyed to the mayor as a letter in mid-June, one priority is listed as follows, quote, fund one or more safe temporary housing options other than overnight shelters, such as safe parking areas, designated camping areas, or single-room occupancy building, including any associated staffing needs. The administration is due to unveil the proposed budget in a little under 3 weeks. Question, is there any money set aside in the 2025 budget for any of those non-shelter options mentioned by the City Council? If so, how much and what for?
I believe that is
Okay.
a you question.
We will not be advocating for any non-shelter options because, as you can see in this plan, there are none recommended. I specifically asked the experts who work in sheltering to work on a plan and make recommendations. There are none recommended in this plan. And at the outset of this plan, what I told our partners was, I would much rather invest a larger amount of money in actually solving a problem than continue to put money at really mitigating the effects of a problem. If we want to work with people to actually get permanently housed and to heal from the traumas that they have experienced in their lives, we need to be investing strategically in a plan that we think is going to work. We have no guarantee that this plan is going to work. If we look around the country, no one has solved this problem. And that's why I am grateful that we have partners like this that are willing to create a model, start trying things, implement solutions that we believe are going to make things better, and add or subtract to it, modify it as needed to create a plan for Bloomington that actually works.
All right, thanks. I'm going to see if there's any other media at this point who'd like to ask a question. Go on up. Thank you.
Hi, my name is Ethan Sandwise. I'm with Indiana Public Media. So I had two questions. One of them is that, it's about those 80 unoccupied beds every night. So that kind of suggests that among people who are experiencing street homelessness, there's some reluctance to use the shelter beds that are available. Is there a plan to kind of address that and try and get more people to use those available beds?
And just to clarify, there are not 80 beds that are vacant on any given night. I believe that's more like 50-ish, but still your point stands. And our plan does address that. One of our recommendations is to analyze the use of beds currently and to identify whether there are additional shelter beds needed, and if so, what type. So, for example, do we need more women's shelter beds? We believe that we do need medical respite beds, but in addition to that, what do we need? So that's something that we're going to be analyzing. And I'll ask any of the other panelists if they'd like to comment on that question. Nope. I think the reasons are probably very complex. I'll just say that.
Okay, thank you. And then the second question is about the deficit of housing units that are under $500 a month. So, and apologies if this is written out in the plan, but is the plan to create new facilities that would have those units, or to use existing facilities in Bloomington to provide those units, or some combination of the two?
I think we're going to need a combination of more than two approaches. We list out in the plan several options, including single-room occupancy. Some communities have purchased hotels and converted hotels into those kinds of units. That's going to be a really heavy lift, honestly. And so we're going to have to work with our community partners, not just the people you see here, but others in the community and hopefully the business community as well, to figure out how we can best address those needs.
Thanks.
Any other comments on that point? All right, thank you.
Hello, I'm Ashton with WTHR in Indianapolis. I know that the survey mentioned that we don't know if this is the actual number of unsheltered people. Is there a better way that the community can go about finding, because the problem may be bigger than the city or county might actually know if the survey isn't reflecting that. Is there a different way to get those numbers if there's people outside of the city limits that we might not know about in terms of unsheltered and unhoused individuals?
Collecting data is very challenging. I think that the survey in May was a far better understanding than the point-in-time count, which is an annual count that happens, as you know, in January. Weather conditions affect that count tremendously, so we feel like we have a more accurate number, but we also believe that it's likely an undercount, and we'll continue to try to find better ways to analyze and measure that data. I'm going to kick it down to the rest of the panelists who've been more involved in data collection, who might give you a better answer.
I can jump in there. So the PIC count is a national practice. Communities all over the country do that. It's mandated by HUD. And that is the way that most communities collect data about people experiencing homelessness. It's done in January because the idea is that it's easier to find people. When it's very cold outside, they're less likely to be camping outdoors. We decided that we wanted to look in May collectively because we wanted to understand what our unsheltered numbers were looking like when it wasn't so cold out. To clarify, we did not only look in Bloomington city limits. This was focused on Monroe County, and so we looked there. But really what we did is reach out to all of our friends doing street outreach and say, list every place that you know where people are camping. And those folks are really good at their jobs. And so we feel confident that they know where many, many people are. The reason we know it's an undercount is because there will always be people who decline to participate. So we did everything that we could think of to make it reasonable for people to participate. We did not collect too much PPI. We did offer some incentives for folks to participate. But we do know that there will always be folks who are mistrustful of that. And for many of them, it's because, unfortunately, they have experience of being treated poorly. And so I think the way that we can increase that is by continuing to fund street outreach workers who do a great job of building trusting relationships. I think the reason we had better participation than in the PIC count was because we did rely on those trained outreach workers who have spent a lot of time and energy building trust and building relationships with people who are sleeping outdoors and very vulnerable.
I'd also add that we've this year made a system change, which is to have a data dashboard that's public. It's on the Heading Home website, headinghomeindiana.org. My colleague Tatiana Wheeler has been instrumental in putting that together, and it pulls from a database that is used in a process called coordinated entry. It's a monthly updated data report and provides a much more real-time reflection of people in our homeless response system.
Thank you.
Other media?
Hello, I'm Shay with WRTV in Indianapolis. What makes this initiative different than other initiatives in the past that you've tried?
Who would like to take that question? Well, I will just say that I think that the collaboration, that's the strength of this plan. We've seen it in the past, but this one is very focused and strategic on this particular issue of street homelessness because it is a crisis. This plan is also more detailed in terms of identifying estimated costs and being very specific about the types of things that need to happen, in many cases a time frame, how they'll be evaluated, and what are some of the challenges. And all of those are listed out in this plan. We tried to be as detailed as possible because it is a very complex situation, and we feel like we have a lot of experts here, but we don't know all the answers, and we also don't know the changing conditions that we'll be facing in the coming months or years. So I think for those reasons, it's different than what we've done in the past. And if there's any other folks who'd like to take a crack at that, please do. All right. Yeah, sure.
And when you guys are working with the homeless here, when they're trying to secure a place to stay, what is the thing stopping them from? Is it price, cost? Is it lack of a place to go like that? What is it? I think you've kind of talked about it. But if you could zero in.
There's no single reason, but I am going to ask one of our service providers to talk about that.
Not a single reason, it's accurate. There is a primary reason, though, and that is a lack of affordable housing. It's very expensive to live in our community. It is hard for single adults to find housing. It is hard for people with felonies to find housing. It is hard for people with evictions to find housing. It's hard for families with young children to find housing. It is hard for a person with none of those problems, but who is just on a lower income. It is hard to find housing. We do not have enough affordable housing.
Follow-up, can you state the split in that on the slide?
Yeah, I'm Emily Pike, EMILY-PIKE.
Any other of our service providers would like to add to that? Forrest or Dana? Carrie, Melissa, Tot?
I just want to echo that housing is extraordinarily complicated, especially in today's economy. And we not only need to have the right price point, but we need to have the right supports for many people in place so that they can remain housed. And I will reiterate that this is the Emergency Housing Action Plan. It goes hand in hand with the Heading Home Plan. The Heading Home Plan is targeted at helping people who are housed keep that housing, helping people who are underhoused get adequately housed, and moving people from streets and shelters into housing. This is going to be a long-term effort. We must provide housing that is affordable or subsidies to make it affordable, and at the same time, work on eviction prevention and supports to keep people in the housing that they have.
I would add that Heading Home's work does include regional work. One of the challenges that we face is that many of our neighboring counties do not have the services that they need for their residents. And so that sometimes brings people to Bloomington or Monroe County. So Heading Home is doing some of that regional outreach. We created a housing task force in Lawrence County, for example. We're working to strengthen their housing network there, and I think that there's a lot of interest. So we're grateful for our community partners in other counties as well, because that's important work as well. All right, other questions? Any media who has not had a chance?
Hi, Anna Chalker with Channel 13 in Indy. I wanted to know if any of the individual providers know kind of yet what they're looking for in this plan, if they've already started their work within this plan, or what is that going to be looking like maybe a year from now, things like that.
Well, I think that since we developed this plan together, some of the answers, if you read the plan itself, are there. But I will open it up to panelists. Would you like to?
I'm really excited about this plan. I know it's going to have a big impact. I am most excited about the enhanced outreach that we're going to be able to have. Funding I feel like we're an entry point as well as the shelters for the unsheltered folks. And working really hard to build that relationship and trust is the first and foremost piece to that. So really being able to expand and enhance outreach for our region, as well as case management, kind of like what Mayor Thomson said, is you really have to couple housing with support. And in order to maintain some of the most vulnerable folks in housing, you have to have that additional case management support. So I'm really excited about those two pieces.
With Melissa here, the tagline for Heading Home is to make homelessness rare, brief, and non-repeating. And so our part as shelters play in that is to make it brief and non-repeating. And so the additional addition of case management support to meet someone as they are entering the homeless management system. So the sooner that we can address that for those individuals, the better off they will be, and we will shorten their time in homelessness. And so that's the goal here, is that we will make that time as they experience homelessness very brief, and then align them with the support systems needed to be successful and retain housing when it is obtained. So that's our hope, and I'm excited to be a part of that at Wheeler Mission, and as we continue to look at our shelter and how we can align ourselves to better incorporate some of the principles here. Thank you.
I think at New Hope, we serve families impacted by homelessness. There are a lot of things that I'm very excited about in this plan. The thing that sticks out for me is the diversion. We know that brief and non-repeating are really important parts, and so is rare. And we don't get the opportunity to work on rare as much as we'd like to. Family homelessness looks a little different sometimes because we have a limited number of units for families. But at New Hope, we won't let any family with a child sleep outside or live in a car. And so being able to focus on helping people never enter shelter is a primary goal that we have. And that's something that this plan calls for us to work on more carefully and more intentionally and more collaboratively. And that's something I feel really excited about.
I mirror the statements by the other panelists. At Middleway House, we serve survivors of domestic violence, sexual violence, and human trafficking. I'm really excited to have the pieces included on diversion and case management. At Middleway House, we are in the process of transitioning our transitional time-limited apartments for families to a permanent supportive housing model. And with that change, I'm very excited to see that in the plan, and knowing that we are going to be able to house individuals and families in our community for as long as they need, meeting their needs better.
Comment on that question?
Well, why not? I think probably one of the areas of the report we haven't really addressed very much yet is the challenge that we're seeing with our community in taking on a significant portion of people experiencing homelessness that are from outside our region. Beacon, through our overnight shelter Friends Places, had a policy for some time where we serve primarily Monroe County residents. We target Monroe County residents with exceptions for people who are fleeing domestic violence and fleeing discrimination, LGBTQ discrimination, and other types of discrimination. And I think that's one challenge that we're going to have to look at really hard as a community is we have a severe bottleneck in the housing side of things here in our community. But we also have to address the reality that we're taking on a bit more than our fair share of serving people in our state and in some cases nation. And we have to think about that and how do we make sure that we're serving people well with quality and attention and care, not just serving as many people as possible. And so that's a particular part of the report that I think will be very important to implement, and we've already started implementing that to some degree.
All right, thank you.
Can I
Of course.
comment? Forrest, thanks for highlighting that. In one of the listening sessions I did at a shelter, I had a single mom speak up and say, you know, I came here because Bloomington has such great services for the homeless, but you all only have enough to keep us all homeless. That is not who we want to be. We want to be solving this problem. And so we will, and it has been a difficult decision, but we will be working on diversion, as Emily mentioned, keeping people housed. And when people are arriving here from out of the region, we are going to work hard on reunification. We need to build excellence in solving the problem for each individual and family that is experiencing homelessness before we continue to open our doors to the rest of the state and nation. So this is a temporary measure, but we are committed to actually solving homelessness individual by individual, family by family.
I guess I'd also like to add that although we are focusing on the very real crisis that we're facing, all of these community partners have been working really hard for many, many years and have successfully housed hundreds of people. The problem is that we have more people entering our homeless response system than we can quickly move into housing. And so we celebrate the people who find houses, find homes. That's a very important thing to remember. But it's a heavy lift, and we want to create more housing for more people so that we don't have people who linger in homelessness. Other questions?
Dave Haskins with the B Square Bulletin again. Given the comments that Forrest Gilmore made and that the mayor just made, I would just wanted to follow up on what is, I think, it's number 4 on the list of strategies. You know, I think every spiritual tradition on the planet for thousands of years has some kind of a concept of welcoming the stranger. And those spiritual traditions, they're not for nothing. I mean, it's bound up in what we think of as moral. It's how we convince ourselves that we are good people. And I guess my question is, how can I embrace that strategy and still feel like I'm a good person?
The pastor first, or you want me to take that first, Forrest?
I can address that a little bit. I think the welcome the stranger is a super powerful moral imperative, and it's a moral imperative for everyone. It's not just a moral imperative for Monroe County or for the region. It's an imperative for every community, and the real challenge is that every community is not stepping up to that imperative. We know very clearly that that communities and states and that are the most effective at addressing homelessness are ones in which each community takes responsibility for those who are becoming homeless in our community. We've seen other parts of the country have taken that approach, and that's a very effective approach. We know that we have limited resources, limited time, limited space, so we can't take on everything. It has to be a larger effort than just our region, and that's what we need to call upon, not just in ourselves, but of everyone, both in Indiana and beyond.
Thank you for those comments, Forrest. I would also offer that it's not loving to set false expectations. And when people arrive here expecting that they will be permanently housed, and we don't have those services to offer, and when they end up in the camps, which, let's be clear, there are safety issues in those camps. We have not actually adequately loved them, nor have we adequately served them. And what keeps me up at night, frankly, is that single mother at the listening session and the truth that she told me a couple of months ago. And so if we want to be the best in the nation at housing the homeless, which I do, we can't say yes to everyone, at least not yet, because we don't have a model that has the abundance to serve absolutely everyone yet. And as I stated before, this is a national crisis. And we are beginning, I believe, to see the effects of the Supreme Court ruling that happened in Oregon. And we need to figure out our success plan. So as Mary said, we have more people moving into housing than we have arriving here in search of it.
Anyone else want to address that question? No? All right. Other questions? Yeah.
Hi again, Ethan from Indiana Public Media. So under the long-term priority needs, there's a point here to restructure the criminal justice system to emphasize some of those recovery services. I guess I would assume that part of that involves the new jail that the county is attempting to build right now. So I wanted to ask a little bit about how the new jail, when it gets built, factors into those plans, and also about the county's involvement more generally, and how we're preparing to, as the city, address the homelessness issue in Monroe County.
All right. The county, Monroe County, is a partner in Heading Home. And we work with them through Heading Home to address some of these regional issues. They are an important part of this plan, and they need to be. Obviously, the new jail is something that's going to impact our entire community and this long-term priority need. But this group did not discuss the jail's role in addressing this plan. One of the suggestions is to create a task force that will include folks from the criminal justice system, including judges, the prosecuting attorney, law enforcement, public defender, and others. And I think that group is going to be instrumental in making some of these longer-term changes that we need. I think that we'll be having I know that in the coming months we'll be having deep conversations with representatives from the county to talk about how they can support this plan, and we're looking forward to that. Do you have anything else to add?
We have been in conversation with the county about this plan, and I'll just echo what Mary said. While we haven't specifically talked about the jail, we do know that the county is talking about recovery pieces within the jail. This group is advocating for longer-term recovery and mental health services. That's an advocacy role right now. As I mentioned in my opening remarks, This is the housing part of a plan. And we need several other action steps to make sure that we have all of the city, the county, our entire community rowing in the same direction as much as we possibly can.
Thanks.
We have time for more questions.
Dave Askins with the B Square Bulletin again. This is just a nuts and bolts question about the rail trail encampments and what the status is. I took a spin through there this morning, and it looks to me like there are some of the campsites that used to have people camping there that have been abandoned. There's at least 2 that have people there. There's people camping on the B line, say, 4 or 5, I would say, sort of close into town. So what's the status of that closure? My understanding is that there's a shortage of caseworkers right now. How many are needed? How many are we short? And any sort of nuts and bolts sort of status report on that closure would be helpful. Thanks.
I can give nuts and bolts on the closure, I'll let somebody else speak to caseworkers. We have, at the request of some of those outreach workers, delayed the closing of that camp to give them a little more time to do work due to the shortage of outreach workers. We do still intend to close that camp in the next couple of weeks. Many of the people that were in that particular camp originally have relocated. So that's what I can tell you about the nuts and bolts on that closure. Do you want to talk about case management maybe, Melissa? Or?
We are down street outreach workers right now. And so we still have a few that are doing all the heavy lifting. And so we're doing the best that we can and really working with people to try to identify any resources, just make sure that they're in coordinated entry so they're connected to services. A lot of them are connected to care in a variety of ways. But as we've said many times, it's a very complex issue. And so, again, building trust and rapport with folks is the most important. So we have that, but I will also say they have experienced a significant amount of trauma, and many of them have been moved multiple times. So, it's complex, and we're doing the best that we can to figure out how to provide the most appropriate support that we can, obviously making sure that they're connected to some other type of coordinated entry with housing and things like that. But in terms of how many case managers could we use? Several.
So do you mean like 6 or 15 or 50?
I mean, in our plan, we're asking for 10 outreach workers and 10 case managers. So I would say 10 absolutely. For outreach workers, we have several several in the community. I don't know what several would look like, but the ones that are doing it right now are pretty. They're thin. So because there's just a lot of work happening. Because outreach workers also just don't do outreach. So they also do a lot of the housing search and placement. So when we're talking about street outreach workers and we're talking about case managers, there's a lot of overlap. So a lot of street outreach workers are also helping folks with housing search and placement and obtaining important documentation, which is very time consuming. So the ones that we have right now committed to street outreach are also doing a lot of case management.
Sorry, go ahead, Emily.
HUD identifies that 1 to 10 is an adequate ratio. And we know that we had, on May 13th, 117 people sleeping outside. We also know that we had a handful, at least, of folks who declined to participate in that survey. So a safe number would be looking at about 14 or 15 folks. And right now, I think Centerstone has 4 working out there. I know that Wheeler's got 1, and we have a couple of others. So we're looking at 6 or 7 that we have right now. And so an addition of 10 would put us in a space to begin making progress and not treading water.
No?
That was basically what I was going to add, is that we're using an intensive case management model, which research shows is very effective, which recommends approximately that 1 to 10 case management ratio.
It doesn't look like we have a lot of additional questions. I am going to invite the public to workshop on this plan, which is next Tuesday, date? The 13th, from 5:30 to 7:30. We will be announcing the location. We haven't nailed that down quite yet. That will be a participatory workshop to help us source ideas for how to best implement this plan and collaborate together. And then in the future, the city will be having another press event to talk about other downtown issues and safety and public health.
We could take one more question, if there is one. No other questions from the media? All right. Well, I guess I'd like to close by striking a tone of optimism. We have many challenges, and we are clear-eyed in identifying those challenges. But we are also optimistic, and we are united and determined to address this crisis in a meaningful way. It's too important for the people who are sleeping on the streets and unhoused or face being homeless, and it's too important for our community. So any of you out there who want to join us in this work, we welcome you, and we thank you all who are here today for coming. I'm sure our panelists are going to be able to spend the next few minutes here if you have other questions you'd like to ask them directly. Otherwise, thanks for coming, and have a good rest of your day.
And thanks to our providers.